and Technology Officer of the Apollo Hospitals Group. In these roles, he spearheads the growth of India's largest digital health platform, Apollo 24/7, providing a comprehensive solution for users' healthcare needs. His leadership ensures the development of robust technology and digital capabilities, delivering a seamless omni-channel experience for Apollo's customers. In an illustrious career spanning over 3 decades, Madhivanan has worked across various industries including FMCG, consumer durables, technology, insurance, and banking. His expertise lies in building and scaling businesses on a global scale. Since 2012, he has led significant technological and digital transformations, serving as the ED and COO of ICICI Prudential Life Insurance, Group Executive and Chief Technology and Digital Officer of ICICI Bank, and ED and Chief Operating Officer of IDFC First Bank. Madhivanan is an alumnus of IIM Calcutta and holds a bachelor's degree in chemistry from Mumbai University. Thank you for joining us today, Madhi. As a moderator of this chat, I would like to invite Subra back onto the stage.
Madhi, I'm so excited that you're joining us today for this session. I was remarking to the earlier panel that I moderated, which was the hospitality industry, that if there are two industries which completely underwent seismic shifts, both in terms of what happened with COVID and post, right? I guess healthcare would probably rank right up there, right? So that's probably, and I think COVID did two things, of course. One is it accelerated certain trends, I would say. For example, things like remote consultations and digital health records probably got a boost, right? But I think it also maybe in some sense caught some of the players in the hospitality industry unawares, right? The pace at which it has progressed with wearable devices and things like that, right? So a great place to start would be just deep diving into the state of the industry as you're seeing it today, right? So what are some of the big kind of trends that you're seeing? What does it mean to hospitality industry as a whole? Healthcare, sorry.
I don't know whether I'm lucky or unfortunate, but I have had this chance to look at this industry, the healthcare industry, both from an outside perspective as a banker, as an insurance person, but also from an internal perspective as somebody who's trying to build a digital framework for a very fast evolving a category. I think COVID woke us up in the sense that, in fact, Apollo 24/7 was a baby of the COVID. It was just before COVID hit us in full force. It was rough around 3 or 4 months back, around 4 or 5 years back, when the story played out. While we had players like Tata 1mg and Pharmacy, which are already there in the pharmacy side of the business, it was primarily seen as an e-commerce derivative. It was not seen as primarily as in healthcare. It was, at the end of the day, a digital way to sell pharmacy. But I think what COVID did was it brought out something which was hitherto always considered not possible in the healthcare. You cannot think of healthcare without being face-to-face with a doctor or a pharmacist or somebody who is taking your phlebo, a diagnostician who is sort of getting... So that entire theory went through, and people, both doctors as well as customers, were very grateful for this interface, which enabled them to be remote and yet being taken care of. I think that was... but since then, the reality that care will always be a combination of these two is here to stay. There is a new normal. It's not that whatever has happened in the digital has gone up, right up there and it's staying put. There is this unique blend of both physical as well as digital, which will continue to be in the healthcare industry. So there is this, I wouldn't call it an hybrid, this is a new term called an omni. There are certain cases where I would like to have the reassurance of meeting a doctor face-to-face or a caregiver face-to-face. And there are certain cases where I am very happy to be sitting remote and making this happen. So COVID was one such unknown. We had I don't know whether it's still a scare or is it something which is going away, again starting off from China. But what's happening is there are a lot of things which are here to stay now. when it comes to especially to the healthcare. You can blame the climatic conditions, you can blame the dramatic amount of interflow which happens and whatnot, but this reality is here to stay. And for a country like India, which is so vast, where healthcare is not a luxury, it is a necessity, the industry per se is very fragmented. So on one hand, you have the Apollos and the Medantas and the Manipals of the world, which are forming the top crux. But on the other side, just across at a stone's throw, we have KEM, which is one of the mega hospitals of this country, and the care that they give us of a very unique level. And that's something which is very access-driven, which is a public necessity. And the reason I'm highlighting this is it's a very fragmented industry, both at the supply level as well as at the demand level. At the supply level, the number of doctors are very limited. It's a very stringent profession. My daughter is a doctor and she's just come out. I can know the challenges that you're going through when you're wanting to do a PG and whatnot. So the supply part of the story is one side and the demand is huge. So that's another challenge and an opportunity. So it's a dichotomy. The third part of it, which we met a lot of the insurance panelists today, is this entire concept of the payer value. Healthcare is not easily affordable. When the government gives it to you, it gives it to you cheap. But when it is a private healthcare, it's huge. And for all the, when people are talking about the potential, the opportunity, I mean, I don't even know, we are experts sitting in insurance here who will talk about the kind of penetration that has happened, whether it be the life side or the health side. We have a huge population out there, but can people afford it? Can people understand it? Do people know what they get into it? So there is this unique conundrum of a provider on one side, the government, the private hospitals, the individual doctors, and on the other side, you're the payer. Are you paying out of your pocket? Are you paying out of an insurance? Even if it is insurance, what are the various dynamics? So these are the broad thought processes. But I still feel very happy that at the end of the day, a few years back, you would always think about going abroad to get superior treatment. In today's world, whether it be Delhi, whether it be Mumbai, at least the top 10, 20 locations, you get some of the really classic care, whether it be an AIIMS in Delhi or an Apollo Proton Care, which talks about cancer on the other side. I think we are able to bring down things to a level. Now, can we take it to what UPI has done in banking to, let's say, citizen scale, is a thing which you'll have to watch out over the next 5 years.
That's so. On that note, so what are the opportunities? Because you're obviously seeing this trend where potentially patient expectations are rising, changing, but our ability to cater to them, like you rightly said, is also undergoing big shifts, right? So what does this mean in terms of where the opportunities lie and where some of the challenges lie in your mind?
So let me put it in context. What do you think is the market share of Apollo? We are the number one healthcare brand in the country. Just some random guess. Not more than 10%. And that too only in Chennai, in Bangalore, a little bit in Delhi because you have got something called Indraprasth. That's how fragmented this market is. Medanta, which we all speak so positive about, or Max, they are localized in that city. In Bombay, do you see an Apollo anywhere? By the way, there is one in CBD, Belapur. There is an Hinduja, there is a Kokilabed. So it's a very, very localized, geographic-centric, high-speciality industry. That's the opportunity. But the challenge in this case is, can I set up, like the way when I was in ICICI, we set up what, 8,000 branches, and SBI is big daddy. Can we set up so many hospitals? No. So this opportunity to find out what is primary, what is secondary, what is tertiary, and then accordingly serve different kind of customers at different places is a reality. So I think that's what we need to, same thing with diagnostics. Dr. Lal is one of the biggest, but I don't think he owns more than 4 or 5% of the total market because 85% of the diagnostic industry is unorganized. It's run by that local flavor. It's run by a franchisee system. So I come from very organized industries. I was a part of Pepsi. I was a part of ICICI Bank. I was a part of IDFC. Very organized, very regulated. While healthcare is regulated, it's so fragmented and it is so necessary. Healthcare is life. It's not roti kapda aur makan. Jinda rahoge to baki teenon milega ye. Pehle zindagi to chahiye. And that's expensive. I think that's where the opportunities are huge. And if I have to correlate your first question with the second, COVID also brought a huge amount of digital interface. First time people realized, so like the way what is happening in the financial services industry, whether it be UPI or digitization or people not coming to the branches, even here, people have started discerning. A mother doesn't want to take her baby to the hospital because there are other fears. The baby might have a cold, but when you walk into a hospital, no matter what is the amount of a discipline that you might follow, you might always catch an infection. You don't know what kind of immunity is. So people in their minds, at least a certain segment of the people, have started differentiating when should I do digital, when should I walk in. Is a follow-up a much better story for digital rather than walking in? In a Bangalore, going to any hospital from anywhere is going to be a mind-boggling exercise. Bombay is getting there. But so I think these are the kind of behavioral things that is happening, and that's where the opportunity lies. A combination of data, knowing your customer very well, behavior-wise, condition-wise. I am a diabetic. If Dilpreet or somebody said Dilpreet is an expert in lifetime value. I'm a mega lifetime value for any hospital group. I know that over my next 10 years or 15 years, I'm going to land up in the hospital for something. So like that, the ability to build those stories is a big opportunity, and we have not even touched the surface.
So that's actually a fantastic and very logical segue to the next question which I have. What does this mean in terms of how hospitals interact with patients? Because clearly it cannot be, in fact, even the word marketing, I would say, is almost abhorrent in this context. But you still need to have those regular, like for example, taking your own example since you brought it up, if a hospital needs to engage with you, they need to be sensitive, but at the same time do want to send you your reminders. They want to talk about your conditions in a meaningful way. So how do you do this? How do you go about even thinking about something like this?
I can answer it in two parts. One, what do I think about it, and what are we doing so badly today? I mean, both can be highlighted. All of us think about hospitals or healthcare only when there are two scenarios. One you call as a very acute syndrome, which is suddenly you got a pain in your stomach. What is it? Is it a kidney stone? Is it something else? So we call it episodic. People usually don't talk about the hospital. We always say stay healthy, stay well. You don't need to run to an hospital. So when it is an episodic, none of this marketing works. Nobody is trying to, at that point of time, what is the closest? Is there somebody who's referring to you, there is so-and-so hospital, go and get it done. So that's a big one. That's where the big money lies. Let me also put it accordingly. That's when an ambulance or your ability to reach out to hospital and get it cured is the best. But there is a much bigger story which we call as the chronic events. India, unfortunately, is a diabetic capital of the world, and similarly, like diabetes, cardiovascular, there is a lot of other chronic conditions which all of us will become a victim of given our lifestyles. The more you become wealthier, more is your sedentary lifestyle, and there are various other So that's a big story. Now, this is where I wouldn't call it marketing, but a concept of continuum of care which you're able to build. Somebody made that example of a Horlicks, about how a woman gets different kind of an Horlicks. That was in the form of a material output. But think of it in the context of, my dad was a diabetic. When I was young, I didn't know, but somewhere you picked it up. Medical sciences today, when it comes to whether the technology, DNA mapping, has the ability to predict how my kids would be and how the family could be. Can a hospital, in a responsible way, hold this data, build what is called as a DNA footprint or a customer footprint? I mean, I'm a banker 20 years, so typically it's a good KYC. You can't get it better than that. You have a file which keeps becoming thicker and thicker. Every consult that you have, every test that you do is adding to that file in the form of a data which is available digitally. It's both a responsibility and an opportunity. A responsibility in terms of the privacy and confidentiality, but opportunity because you're able to then take care of me, and my family. Now, you walk into any of the hospitals, we have I think if I'm not mistaken, the old Global, which is renamed Glen now. If you walk into it, you go with a paper folder. Can you imagine your insight is sitting in that paper? The ability to convert that paper into a digital input and build it in a very organized way is a mega opportunity, not just from a marketing perspective, but from a care. And this is where I think our chairman, who's 93 years old, who is responsible for the Apollo, keeps talking about 3 C's. Uh, he calls it care. You have to be continuously be talking about care for your patients. Then comes the affordable cost, because India, which is the second C in his mind. And third is clinical outcome. No matter what happens, when you treat 100 people, did 95 come out of them on their legs, or 5 of them go, that is an obsession. And if you can do that at an effective cost, damn good. And if you can provide a payer model through an insurance mechanism with a much larger ecosystem, that's fantastic for the nation and for the overall. So I think this is able. But are we doing it? No. Today morning, I got a call from a very, very strong mentor of mine who said, Madhi, I went to your app. Early in the morning, I was having an headache. I opened the app. I wanted a simple paracetamol. But in that homepage, you're bloody cross-selling me insurance. You're telling me when to do the next consult. What are you going to buy? Oh, it is winter, so therefore winter care products. She gave me a mouthful early in the morning. But if you ask my marketing guy, that's what he's driving, because he's trying to look at a long-term value of this customer who has taken down my app. Can I be an Amazon on one side? Can I be a Practo on the other? And can I be a Dr. Lal on the third? And by the way, can I support my Apollo hospital in the form of traffic? So when this comes, now this, while I'm using data beautifully, and I'm running some of the best LTV models in the back end, from a consumer's perspective, who's looking at it as Apollo, which stands for care and trust, is it delivering? I have no idea. So, and we are doing this to what, 20 million customers? Or maybe सुबह से उठ के ये पूछूंगा बे आज कितना धंधा हुआ? So I think this conundrum is something which we have to manage. And if we can find a way, and unlike Zepto, which my wife opens out 5 times in a day and orders $300 worth, my app is going to get opened maybe once or twice in a month. And that too when I want a medicine or I'm genuinely having a problem and I want to consult somebody. So here is this battle of, are you an e-commerce? Are you an insurance company? Are you a healthcare company? So the ability, but all of them are important for the continuum of care. So how do you build it? How do you take care of the chronic? How do you ensure that the Blinkit's ambulance story is viral? Because it's genuinely there is an underlying need. Now, how do you make that happen? So I think those are the play that we are looking at. So the relevance, the sensitivity, the ability to do not marketing, but to understand exactly when should I help you? When would you need my help? Can I anticipate it? The medicines that you're buying, your molecules are suddenly changing. Is it a harbinger of something wrong going to happen? Can I warn you? That's not marketing. That's taking care of you. But then doing it very intelligently on an n equal to 1. It's not a segment. You're a segment of 1. You are buying an XYZ Januvet or whatever for a particular way, and suddenly if somebody has recommended that you need to buy something else, chances are you'll end up in a hospital 3 months down the line. And every incident that we speak about, a 40-year-old passing away through cardiac arrest, etc., I think a lifestyle, our stresses are so very unique. It's a mega opportunity to serve. How do we do it is, we'll have to see how it plays out.
So you spoke of course, 2-3 things in the context of why this is being done badly in your own words, although I'm sure there is progress being made. And of course, number 1. Number 2, you spoke of how digital health records are still not getting digitized, and therefore your understanding of the patient and therefore your ability to deliver on the care cost clinical outcomes is not coming through, right? In many ways, you could argue that you maybe do a good job of episodic, but not necessarily chronic. Why is that? Is it fundamentally, and maybe you can take a technology/data perspective to this, right? Because I'm sure there are facets that you can cover in terms of why we are not able to do this well. But if you purely take a data/tech perspective, what do you think is going wrong?
First and foremost, data is in silos. It's not there in one place. Healthcare is roughly where banking was 20 years back, when we didn't have a CIBIL, when we didn't have an IRDA, which had a insurance base. Healthcare has a lot of data within the hospital, within their service. Even for a group like Apollo, which has a pharmacy, which has diagnostics, which has home care, which has hospitals, which has clinics, each one of us has our data in our respective service. Whether it be because they're separate entities. When we had Apollo Munich, which was an insurance company, it was a standalone entity, which had its own data. So the biggest, and now take it to the India level. What Ayushman Bharat is trying to build is an equivalent of a DigiLocker for health records. The concept seems powerful, the concept seems fantastic. But is there a uniformity of code? When you talk about the technology lens, do we have a protocol which is similar to a backend protocol which says that this is how you should measure blood pressure, this is how you should document a particular record? So that's the ecosystem play. But even within a group, the fact that you have different silos, data might not necessarily be complete, data might not necessarily be uniquely cleaned up, is a huge one. 10 years back, I cannot imagine that there's possibility. But today, there is a possibility of actually creating a data world and not let Google and Amazon do it, but actually build it yourself and create that value and convert raw data into what I would call as processed and unique data, and then convert that into insights which will help us take care. So that's a possibility, but I think siloization, lack of completeness, inability to constantly validate whether this data is correct or wrong is important. So what we will need, if I have to look at an India level, an equivalent of a Civil or an Experian which talks about at a public level, but even within organizations, an extremely strong data culture which has the ability to treat every customer as unique and constantly build this file. For me, insurance is one leg. For me, diagnostic is another piece of paper. Now, but it's not just again one person. When you look at my data is a combination of me, my wife, my children, and my mother, because that's whom I support, and that's my front end. I'm the payer. So this story, your ability to discern it, slice it into pieces, are the ones which tech should help us today. And today it's possible, but things needs to happen.
Especially so in your case, and this goes back to some of the conversations that I've had with you. What have been, maybe if you had to call out 2-3 big learnings or your own understanding of how to make this happen, what would those look like?
I'll give you 2 again examples. In IDFC, I spent around 4 years. It was a new bank. The biggest achievement was creating a data pipeline engine. The concept of ingesting data of your financial, it is much less sensitive. I mean, compared to health, it's virtually nothing. I mean, kitna paisa aaya har month savings account mein, credit card mein kitna spend kiya. Multiple different core banking systems which is taking the feed and putting it. It took us around a year and a half just to put a basic data lake in process. I'm not talking about data mart, but a data lake. And then running the pipeline engines and making that run with a very high degree of efficiency and whatnot. ICICI still built it on a classical data mart module. Technology has progressed. Apollo is already on the cloud. Unlike the banking system which was not on the cloud, here Apollo has it's already sitting on a GCP, somebody is sitting on an Azure, somebody is sitting on an AWS. So data is available, but your ability to bring it together, build what I would call as a composable, how do I put it, in your language, the CDP, an equivalent of a composable CDP, which is not a rigid structure but has the ability to play around differently, is very important. So if I have to look at it, I need to look at the same data from different lenses. One day I look at it from an insurance lens. The other way I look at it from a payment lens. The third day I look at it from a chronic lens. Or the 5th day from a episodic bit of how many cardiovascular patients, which is a big, there is a term called Congo in our language. Congo is nothing but cardiac, onco, N stands for neuro, the mental health cases are going dramatically high. G stands for gastro, and the last O stands for orthopedic. Can all of you identify with it? All the 5? This is our segmentation. We spoke about the hospitality industry, talk about Gen Z. We call it Zen H, and say the H is in various different ways. And that people that are wellness people who are supposed to be exercising every first year, etc. So anyway, so that's the story. So the different views, whereas when a doctor looks at it, he is not bothered about everything. When you come in, do I know Subra's history? Can I treat him so well because somebody else has already done the heavy work? I don't have to go through 20 pages. I should not miss out something which is there in your record, and as a good doctor, somebody should have done that work for me. So we have something called as a clinical investigation engine, which is driven by machine learning language. If that engine needs to run, and if that needs to get into an AI tomorrow, I need the data, underlying data to be good. If my underlying data is picking up my mother's data and showing it to the doctor as my data, then I'm in a mess. So I think this kind of the ability, this is the challenge. Ingestion, making a data clean room, and now with DPDP becoming an act, can I use it? You're like, how do I get the consent? How do I tell you that, boss, this is for your information? You will first say, you will take the data and send me an insurance policy tomorrow. Or you'll try to badger me with phone calls for something else. All of you guys spoke about partnership, right? How do I build a partner? I don't want to give my data to the insurance company, but I want to sell that product so that it becomes a seamless experience. Now, is there a way to manage it through a macro data? So I think as the DPDP Act flows in, we'll have to take care of the governance story. Once you do the governance story, I think the biggest opportunity for us is the ability to cohortize each one of them. Diabetics in Tamil Nadu versus diabetics in Punjab. Very different kind of a set. So anyway, we can keep going on. This is a kind of the way, but it's a lot of hard work. In my mind, at least it's around 2 to 3 years. The lack of tech, the lack of the ability to stitch it together, but the opportunity is fantastic. I mean, I've seen technology grow over the last 20 years. I think the era that we are in is mine. Unfortunately, I'm getting old, so somebody else will run it. But we'll play.
No, but to end the session, I just want to, since you said technology has developed incredibly in the last 20 years, I don't think it's going to stop. So wearable tech as well as AI is only going to keep growing exponentially. So if you had to fast forward, let's say a decade down the line, what does the world look like for you, the healthcare world?
I wouldn't even go down a decade. Last 3 months back, I was in San Jose, and I met one of our some old Gujarati friend who left India 20 years back and was a multi-billionaire. And he was talking about a concept called agentic AI.
Yes.
Check out this company. It's called Hippocratic.ai, which was on stealth and it has come out. What he is effectively doing is he's using publicly available data, building an equivalent of a med LLM, and then creating, in a way, a nurse or a coach who will be able to take care of specific ailments. So diabetic, PCOD, menstruation when you're switching over, the menopause-related activities. So building the huge knowledge base and converting it into almost like an assistant. And in the US, it's huge because of the dearth of nurses, dearth of health assistants. Doctors don't want to go beyond what is told to them because of the insurance laws and the very strict. So the ability to, and this agent talks to you. It talks to you like the Siri or an Alexa. And that story is building out in a dramatically fast way. So that's one. India does not have the problem of not having people, but do we have skilled people? Do we have the familiarity? I think Deepa spoke about the opportunity to institutionalize behavior. Taj has done it beautifully. When I go to a Taj Coromandel or a Taj, there is a certain level of, now can I do it in the hospital? The nurse who is in an OBG ward, who's so stressed, will she be able to behave with a smile on her face when she is delivering? So is clinical care more important or what it is? So I think when you build tools like this, which is not replacing human beings, but is actually making them a mega productivity enabler, that's what we want to go. And healthcare will never become 100% automated. It will always need the arm of a human being, whether it be a nurse or a clinical assistant or a doctor. But if there is a superpower called an agentic AI, which is within the framework, does not do biases, and that last mile can be sorted by this human being, I think that's the vision that we're looking at. So imagine India can become Dr. Reddy went and met our PM, and while he was explaining the vision, I believe PM Modi said, yes, he said, we want to build it in India, we want to take care. Well, no, you should heal the world. Try to become the equivalent of an Infosys so that you're building the capability here. Without our people going out, is there a possibility of taking care of those? And that's possible today.
I can't think of a more perfect moment to end this session. Madhi, thank you so much. This was so insightful for all of us. Really, really appreciate your time. Thank you. I thought this was a fantastic session. So big round of applause for Madhi. Thank you so much.
Thank you, Madhi and Subra, for this thought-provoking and insightful chat. Your perspectives were truly enlightening. I request Subra to present a token of appreciation. Madhi.